Thank you everyone for joining us. Welcome to this collaborative media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. Record COVID-19 cases in North Carolina threaten to place a heavier burden than ever on hospital emergency departments across the state. We have chief medical officers from Duke, UNC Rex, and WakeMed Health Systems with us today to discuss conditions in their respective emergency rooms and how the public can help make sure they're being used in the most appropriate way. With us today is Dr. Linda Butler. She is Chief Medical Officer and Vice President of Medical Affairs at UNC Rex Healthcare. Also joining us is Dr. Chris DiRienzo. He is System Chief Medical Officer and Senior Vice President for Quality at WakeMed Health and Hospitals. And we have Dr. Lisa Pickett. She is Chief Medical Officer at Duke University Hospital and Assistant Professor of Surgery and Medicine at the Duke University School of Medicine. Okay, Dr. Butler, we'll start with you. Can you just tell us a little bit briefly about current conditions in your emergency room and some of the things that the public can do to help avoid overburdening it?
Yes, good morning, everybody. Thank you for participating in the press conference. We have had increased volumes in both of our emergency departments, the one in Holly Springs and the one in Raleigh, as well as our multiple urgent cares across the county. There have been increased wait times for several reasons. Most importantly, because the hospital is full, we are sometimes holding inpatients in our emergency department as they're waiting for a bed. And the patients are waiting in the emergency waiting room for a while to be assessed. So if you are just there for a COVID test, then the best place to go would be to one of the testing centers where you can get in and out much more efficiently, even if there is a line then coming to our emergency department. If you have mild symptoms and you want to be assessed, then you're welcome to go to an urgent care. I know our urgent cares in the past week did more than 2,000 COVID tests, and you get the answer back just as quickly as if you would go to the emergency department for a test. And then finally, if you do have severe symptoms, the emergency department is probably the best place for you to be. We did see early on in the very beginning of this pandemic, can't believe it was 2 years ago, some patients delayed care for emergency situations because they were afraid of coming to the ED and maybe being exposed to COVID. That's not really your fear now because COVID's out in the community, so don't delay treatment for a stroke or a heart attack. We definitely want to go ahead and have you come in. The other challenge when you come into emergency department and you get a COVID test, you are then going to be competing with all of the inpatients for the same lab resource. So it may delay testing for our inpatients because we only have one machine and all of the same labs are being run on it. We are offloading our own lab by having our coworkers and teammates get tested with a resource that is outsourced so that it's being sent elsewhere so we can get a quicker turnaround time for inpatients and people in the ED. And then the final ask really doesn't have to do with testing, but has to do with vaccination. I have to put this plug in here that if you're not vaccinated, please, please, please get vaccinated, even if you've already had COVID. And if you've had your 2 doses of a vaccine, and it's been more than 6 months, please consider getting boosted because that is the one thing that we know lessens the severity of illness. It will keep you from being admitted to the hospital and definitely reduces deaths. So thank you for the opportunity to share a situation and call on the community to help.
Absolutely, Dr. Butler. Thank you very much. Dr. DiRienzo, could you tell us a little bit about what you guys are seeing at WakeMed Health?
Absolutely, Greg, and thank you again for having the three of us. I think you'll be hearing a shared community message from the Triangle here around these emergency department volumes. Here at WakeMed, 5 of the last 10 days, we have set records for emergency department volumes across the 7 EDs in our system. The emergency departments are seeing truly crushing volumes related to COVID. When you go into those numbers, about 40% of the patients we've seen in the past week have presented with some kind of either COVID-like symptom or for screening. And really, I think the message that we're trying to get to folks here today is if you have symptoms, then absolutely seek the right place of care. But if you're coming, for example, because you tested positive and now you're trying to seek another test to see if you're now testing negative, if you're coming for just exposure testing because you got a positive exposure in the community and you're completely asymptomatic, those are real stories. The emergency department is not the best place for you. And Dr. Butler explained just why. Our emergency department triaging system is focused on how acutely someone is, meaning the sicker you are, the faster we're trying to get you back to a room and get you taken care of. And so folks who really are very mildly symptomatic or completely asymptomatic are going to wait longer in any emergency department system. As a reminder, if folks are trying to access our WakeMed emergency department, you can go on the app and see those wait times in real time. I did want to also say a thank you to the county and the state. Here in Wake County, we are blessed to have testing access that's run by partners with the state and the county that don't exist in other parts of the state. There are definitely testing options for folks who are in need of screening outside of care settings. And again, if you're completely asymptomatic, getting just an exposure test, that's by far the best place for you to be. To put a really fine point on what Dr. Butler said about vaccination, you have heard in the media that Omicron is a milder illness, and the data seems to be supporting that. But when we look at our ICU volumes today, here across WakeMed, we have no vaccinated COVID patients on ventilators, and around 1 in 10 of our COVID ICU patients are fully vaccinated. So really the take-home message is vaccination is tremendously protective against getting severely sick and needing to be intubated. And even while we're in the midst of this surge, there is widespread vaccination availability. Thank you again for inviting us to join. I'll turn it back to you.
Absolutely, thank you. Dr. Pickett, could you talk a little bit about what you're seeing at Duke also, please?
Absolutely, and I share the same message that my prior two colleagues have, which this is a different point in the pandemic than we have seen, in that our EDs have come back to pre-pandemic levels, and in fact now with the additional surge, they're above the pre-pandemic levels. So we too have seen record numbers in our emergency departments. But in addition to that, we have seen a time where our staff is ill, and gratefully, we have lived our values of caring for our patients and loved ones and each other and required vaccinations. So our staff is not becoming terribly ill, but they are out. So it is limiting our ability to provide all of the care we would like to, have all of the beds open. And so we are doing our best to tend to all of the patients who present to the emergency room, but agree fully. The emergency room is best served for those who are very ill, and we want to be sure that we are always available for those who are ill and need emergency care. And we appreciate, in fact, just this week, Durham County setting up a second testing site so that people who just need a test don't have to come and have a lengthy wait in the emergency room just to get that testing that they need. If they have significant symptoms or health concerns, we always want to be available to give them that care in the emergency department. We're also limited by the fact that our inpatient census of COVID has nearly tripled in the last 2 weeks, and that our length of stay is increased because those patients who would ordinarily go home with home health or home to their home of a nursing home are no longer able to accept those patients so freely. So we're partnering with the state to understand the best ways that we can transition those patients back to a more appropriate location as well. But that is limiting our throughput of patients and making for longer wait times of patients who need hospital admission to wait in the emergency department before going up to a bed. The best really approach that we can recommend is 100%. If you have not been vaccinated, get vaccinated. It's free, it's available, and it is the best protection from hospitalization and critical care needs. And looking at our numbers too throughout the Duke Health system, those people who are hospitalized are nearly universally unvaccinated, and those most critically ill patients on ventilators are greater than 90% unvaccinated. Those on ECMO, the highest level of support for the most ill patients, 100% are unvaccinated patients. Vaccination is the key to staying out of the intensive care unit, staying off the ventilator, and death from COVID. And so we cannot strongly enough encourage our community to stay healthy and be vaccinated. And if you have mild symptoms or just an exposure, find a testing site. But if you're having significant symptoms, we want to be ready to receive you in our emergency department, and we're happy to do that.
Absolutely. Thank you, Dr. Pickett, and thank you to all of our panelists for those opening remarks. Dr. Butler, I'd like to come back to you briefly. Dr. DiRienzo and Dr. Pickett both explicitly highlighted the fact that so many of the most critically ill patients in their hospitals are unvaccinated. And I'm wondering if you could offer a perspective on that from the UNC system too. Is that consistent with what you are seeing?
That is definitely consistent. We do see that a majority of the hospitalized patients are unvaccinated, and 100% of the ventilated patients, at least in our hospital, are those that are unvaccinated. We're all in the same situation. We're all in line. And we also have the same challenge as our Duke and Wake Med colleagues, with our staff having to be out because they're ill. And we have fewer people to take care of staff. Then a consequence is we're doing less procedures. We've delayed those or canceled some so that we have staff to take care of inpatients. But we opened up beds earlier on in the pandemic, and now we've had to close because we don't have the staff.
Sure, absolutely. Thank you. And thank you for clarifying that. We are going to open it up to questions now. Thank you to everyone who submitted questions ahead of time. You can pose questions via the Q&A window at any time. If you would like to ask a question in person, please raise your hand in Zoom and we'll unmute you when your turn comes around. If you're calling in by phone, you can raise your hand by pressing *9. And while we're waiting for questions to come in, something I wanted to ask all of you panelists is, obviously you've all emphasized the need for people to go elsewhere than the emergency room if all they're looking for is a test or to confirm that they are positive after an exposure. One of the things I want to be able to hit home for people is the resources that are available. You guys have mentioned the urgent care if you have mild symptoms, and that there are testing centers. So one of the things I'd like each of you to maybe talk about a little bit is some of those resources. Should people look for testing centers through the county that they're in? Should there be state resources? I know there are pharmacies. What are some of the testing things that people can look at when all of a sudden they find themselves in need of a test? And Dr. DiRienzo, maybe you can kick us off.
Absolutely, Greg. So again, here in Wake County, we're blessed to have a multitude of county-run through partnerships testing centers. And there's, I believe, at least 5 of those. It is an online scheduling system. And I believe one actually opened yesterday that requires no appointment in the North Raleigh area. The state has actually also partnered to bring 3 large-scale testing options here into the community, including a very large drive-through at PNC Arena. So across Wake County, there are a multitude of totally screening testing options. As you noted earlier, each of our health systems also provides a spectrum of care, ranging from primary care to urgent care to emergency departments. So people who are seeking care can access care at the level that they need. Very mild symptoms is the kind of thing that may carry a long wait in the emergency department, but you may be able to get an acute visit with your primary care doctor or an urgent care much quicker. And then obviously, if you're significantly sick, the ED is where you want to be. And it's why we're having this conversation, so we can be best prepared to take care of you there.
Absolutely. Thank you. Dr. Pickett, you touched on some of the resources available in Durham County. I'm wondering if you could talk a little bit more about where people can turn when they have a need of a COVID test.
Sure. So simply going online and putting in Durham County COVID test. So there are 2 testing sites that are available during the day, and you can get online and look for those. I think too, the other option is that if you do not need that test because you're a high-risk person or for school or for work, if you have symptoms at this point in time, I would assume that this is COVID, and I would go ahead and isolate yourself appropriately and stay away from others as best you can. Now, for more significant symptoms, of course, present to the emergency room to urgent care as appropriate. But I would assume that most symptoms at this point in time, based upon the prevalence in our community, is in fact COVID.
Sure, absolutely. Thank you. And Dr. Butler, same question to you. Obviously, UNC Rex operates in a number of counties. What other kind of resources would you point to people to?
Well, I don't have much to add to what Dr. DiRienzo said for Wake County. We also do have urgent cares that can do the testing. We had some respiratory diagnostic centers that are still open that are doing the testing. And I think Walgreens, CVS, some of the pharmacies also have options, but I would check online before you go to one because I don't think it's universal. So there are plenty of options out there, and patients can choose a location that's convenient to them geographically that meets their needs.
Absolutely, thank you. And thanks to everyone who submitted questions. We're going to whiz through these as quickly as possible. And panelists, if your answers to these questions are short, that is absolutely fine. But I'm going to go through them all here. And Dr. Pickett, I'll direct this to you. We've had a question here about what, if you can describe what people are experiencing when they do go to an emergency room in terms of wait times, places to sit. What kind of crowding are you seeing? What are the conditions like?
Sure. Well, obviously, when we have a great number of people in the waiting room, we're closer with patients are closer than we would like for them to be. We do try to limit the number of people who come with patients to try to space them out. We do have a special seating area for those patients with respiratory illness. As we've had to pivot pretty quickly, we're also looking to expand potentially into a tent outside and provide that care there, protecting those patients who may have symptoms but maybe aren't COVID positive from getting COVID while they're in our emergency room is our primary goal, and to address symptoms the most severe first.
Sure, absolutely. Dr. Butler, can you kind of describe what people are seeing when they're coming to your emergency rooms right now?
Yes, we have the same restriction on visitors. If someone's in the waiting room waiting to be seen, we ask the visitor to stay in their vehicle. And then once they're brought back into a room, then we allow the visitor to come in. Of course, we have exceptions if it's a younger child or an adult who may have memory issues. But we are trying to physically distance people as much as possible. And we try and separate out people who have respiratory type symptoms from those who do not to protect them. And of course, every patient and visitor needs to be masked as well. So all of those infection prevention measures are in place. We also at times do have a longer wait, and we continually reassess patients in the waiting room and triage who needs to be brought back first. And we want to make sure that our EMS colleagues aren't waiting to drop off those patients, because when you get really full, that's impacted as well. And I know all three of the emergency departments in Raleigh work together to make sure that they're able to accept patients that come in. So it's similar to what Dr. Pickett has described at Duke.
Sure, absolutely. Thank you. Dr. DeRienzo, anything to add about conditions in Wake Med ERs right now?
The only thing I would add is a reminder that we have real-time monitoring of the wait times in our emergency departments and elsewhere that's visible online. So if you're making a decision about which ER to come to, then that is a good way to know what the wait might be like in one versus another. Obviously, if you're sick enough that you need to call EMS, they will bring you to the closest place that can take care of you.
Sure, absolutely. Thank you all for that. We're getting lots of questions coming in. I'm going to whiz through as many of them as we can. We've had one here asking about staffing, what the kind of staffing strain that the Omicron variant has had on your hospitals. You've all kind of touched on this a little bit. Do you have any sense of how badly your workforce is affected in terms of absences through positive tests amongst the workforce? And Dr. DeRienzo, we'll stay with you, and you can tackle that first if you don't mind.
Happy to. So there's two kinds of absences related to COVID protocols, as folks in the community are aware. There are folks who test positive, and there are some CDC guidelines specifically for healthcare workers around if someone tests positive and is asymptomatic, how quickly they can come back to work, and if they're sicker, how quickly they can come back to work. And then there's also exposures. And if you look at the vaccine requirements that others have spoken to, that's keeping a large number of folks who have some kind of an exposure, a non-high risk exposure, able to continue working because those CDC guidelines allow people who are vaccinated and boosted to be able to protect themselves and others from contracting COVID. And so we've seen and have reported out now a couple of times that through the past week, it's been about 2% of our workforce who are in some version of COVID protocols. And that's not to be unexpected. When we look at our community right now, we're seeing a higher prevalence of COVID with this fast spreading Omicron variant than we have ever seen before. And so healthcare workers are just like everyone who's watching, we're members of the community as well.
Sure, absolutely. Thank you. Dr. Pickett, anything you can add about how it's affecting staffing at Duke?
Yeah, no, absolutely agree. About 2% of our staff is out, and we follow the same CDC guidelines to bring folks back to work. We make every effort to make certain that they're as safe as possible doing their work, but we know that they live in our communities where the prevalence is so high. So we are making good decisions and planning to try to take care of patients with different models that allow us to do that with the staff that we do have here.
Sure, thank you. Dr. Butler, anything to add?
We're in the same situation as my colleagues at both Duke and Wake Med. We do have a significant number of people who are out as COVID positive, and there are still some who are quarantined, depending on their type of exposure. I think it's people always think about the clinical at the bedside folks, but it really has crossed all departments. And if you have environmental services, you have food and nutrition affected. You've got other teammates who really are there to help support the patients and the other care providers. You have departments that are affected, and it can really cause delays across the board. So it's not just nurses, physicians, APPs. It's everybody who has been exposed or sick who can impact care.
Sure, absolutely. Thank you all for that. We've had some questions about ICU capacity. Dr. Pickett, we'll start with you. One of the questions we've had here is what are the contingency plans for when there are limited or no ICU beds available? And what's the current situation at Duke with regards to ICU capacity?
Yeah, our ICU is very much at capacity. So our contingency plans is that we have critical care resource nurses, so that if there are patients on the floor who require critical care while we're creating a bed to become available to care for that patient, we can deliver the critical care that they need on the floor, something called sort of sheltering in place or caring for them in place. We also maintain a practice of having a COVID ICU bed available because we know that sometimes those patients decompensate very quickly and need to go to a specialized area for care. We also, as my colleagues have talked about, continue to look at our operating room schedule in cases that could be delayed or deferred or being delayed to be sure that we have the capacity to meet the needs of those who urgently need care.
Sure, thank you. Dr. Butler, same question to you. What are you seeing in the ICU and what are the contingency plans?
Yeah, we're also at capacity. We had opened up an additional 8 beds earlier in the pandemic to specifically be for COVID patients, but we've long since spilled over that critical care unit and have COVID patients in all of our ICUs. We also have we call a critical response team that goes out to the floors and helps the nurses stabilize patients there while we're creating a bed. We always try and leave 1 bed open for STEMI or heart attack patients, 1 for stroke patient, 1 for a COVID patient. But sometimes you have several ICU patients come to your ED, or there's a request for a transfer. And so we try and prioritize who needs the bed first and move patients accordingly. But it is a daily challenge, and we meet daily to figure out what's the best way to care for the community.
Absolutely, thank you. Dr. DeRienzo, the situation at Wake vis-a-vis ICU.
Yeah, really nothing to add. It is a daily challenge, I think, for all 3 health systems.
Absolutely, thank you. As we mentioned at the top, one of the main reasons that we're here today doing this specific event is to redirect people that just need a COVID test elsewhere from the emergency room. We've had a question here. If you can give us a sense of how many people or what proportion of people coming to the emergency room are actually coming to seek a COVID test that they could easily get elsewhere and are not experiencing severe symptoms. And Dr. DeRienzo, why don't you kick us off with that?
Absolutely. So we looked at our numbers for the past week, and again, of all emergency department patients, about 40% were seeking some kind of care related either specifically to COVID or a COVID related symptom like upper respiratory symptoms. Of those, so of that 40%, 1 in 8 were there with no symptoms whatsoever. So about 5% total of our emergency department volume last week were folks who were there exclusively asymptomatic for a screening test.
Sure, absolutely, which I guess might not seem like much, but then that's 5% of people maybe with extremely severe symptoms that were behind those people in line. So that can have a huge impact. Dr. Butler, do you have any kind of figures for how that looks in UNC Rex ERs?
I don't have exact figures on how many were there just for the COVID test, because a lot of times they have other issues that they want to have addressed when they come. I do know that at this wave, we have much fewer of those patients actually being admitted. So I would extrapolate from that they're not as sick and they probably could have gotten their COVID test elsewhere, and not necessarily come to the emergency department. But we probably have maybe a third of who is coming into our ED. So similar numbers to what Dr. DiRenzo said, getting a COVID test. So it is a substantial number of people.
Sure, absolutely. Thank you. And Dr. Pickett, anything to add from a Duke perspective?
No, very similar numbers. Agree completely.
Absolutely. Thank you. We're almost at time here, but we're going to whiz through as many questions as we can. Another question we've had here about whether your hospitals are having to delay elective procedures, much as was happening in the early days of the pandemic, and also whether a shortage of blood supply is contributing to that or causing problems in treating COVID patients. And Dr. Pickett, we'll stay with you.
Yeah, so we definitely have looked for the last several weeks and limited the number of cases that we would post that could be delayed. We have them categorized based upon the safety of being able to delay their care a bit. And we are actively delaying care this week. We have experienced a pretty substantial blood shortage throughout our health system. And although we have not had to deny blood ever to anyone, we have had to reorder cases and look daily at the blood types of those patients who have planned operative cases. And so it's something we've kept an eye on, maybe reordered cases or delayed them just a day or two to allow us to safely do those operations and not get to a place where we couldn't offer blood when blood was needed.
Absolutely. Thank you. Dr. Butler, what's you seeing at the UNC system with regards to blood and potential delay of elective procedures?
We've had the same challenges with the blood supply. So definitely, I think practice has changed overall. We don't order blood as often now as we did back in the day when I trained. So people really realize it is a scarce resource and is not just ordered without much thought. We also have had to reorder procedures if we know that we've had a limited supply. But like Dr. Pickett, we've not had to worry about, we really wanted to get blood and did not have it. So far we're managing through. As far as our procedures, we kind of started January at not full volume intentionally. We've actually closed 3 ORs, and that will keep you from having as many cases in. And we are having procedures that are being discharged and not requiring a bed are less of a challenge than those that are actually taking up a bed. But we are managing our schedule daily and canceling some cases when we need to, and very careful to not delay something that is emergent or urgent. Those always will go forward, but looking at our elective schedule.
Absolutely. And Dr. DiRenzo, same question to you.
Well said by my colleagues on the other side of the blue divide there. Looking at capacity management has become core of our daily processes across the hospital. It's had to become that way, given the number of waves we've seen here in the COVID pandemic. And so not much more than that to add.
Sure, thank you. And we are just about time here, but I wanted to have the opportunity to ask one final question to each of you. And it's a question we've had come in that asked, what are the potential effects of this surge to patients visiting ERs for other reasons if this continues to worsen? And I'm not looking for any of you to scream crisis, but are we looking at just further delays or something worse, like patients not being able to be seen in the ER at all? Dr. Pickett, if you wouldn't mind starting off.
As we've said, we'll always meet the needs, but clearly we cannot be as quick to get to everyone if there are so many patients coming and seeking emergency care. So I believe our community can best partner with us by getting a vaccine so that they don't become ill, by seeking testing elsewhere if they have only mild symptoms or are completely asymptomatic, so that our emergency care is really reserved for emergency care. And then if they are healthy and well and able to donate blood to offset that shortage, that would be helpful to our team well and contribute to our community health.
Absolutely, thank you. Dr. Butler, same closing question to you.
Yes. The emergency room doors never close. They are always open. But as Dr. Pickett said, the more patients we have coming in, the longer the waits will be. And we want to provide the best service. So we ask the community to partner with us and choose the best location, the right patient, the right location, the right time. Also, like we said in the very beginning, and Dr. Pickett emphasized again, vaccinate. That's the one thing you can do that's preventative, and be compliant with your mask. Make sure you're wearing it correctly. Practice good hand hygiene. Those two things will protect you against other viruses that are out there that we haven't really talked about, and sometimes people forget. There's still flu there. There's a metapneumovirus. There's RSV. There's all sorts of other things that can bring you into the emergency department or make you sick. And also donating blood is a great suggestion. The Blood Connection did a press conference a while back trying to encourage our community to give a little gift of yourself during the season.
Thank you. And Dr. DiRienzo, a closing word from you.
I appreciate it, Greg. I think the question that someone asked there around, well, what happens if I come? Will you still take care of me? Our emergency department team members are really heroes, and I have seen them do heroic things wherever we've had to set up care spaces, and that includes in the lobby. During the Delta surge, we had to create lobby care pods for 2 of our hospitals. We've had to just restart doing that again. And so our emergency department team members are truly incredible clinicians, and they will go to heroic measures no matter where they're asked to do it. I think our big ask for the community is, if that's not what you need right now, then there are many other places where you can seek care, such that if that is unfortunately what you wind up needing at some point for COVID or for anything non-COVID related, then the heroes who run our emergency departments will have the space, the people, the support, and the resources needed to provide care to you as fast as possible.
Absolutely. Thank you, Dr. DiRienzo. And I think we'll call it there. Thank you, everyone, for joining us. Thank you to our panelists, Dr. Linda Butler, Dr. Chris DiRienzo, and Dr. Lisa Pickett, for sharing your expertise. If you'd like to be notified of upcoming briefings, please email dukenews@duke.edu. In the meantime, please follow public health guidance, get vaccinated and boosted, give blood, and avoid emergency rooms unless you are experiencing an emergency. Thank you and have a great day.